Hello, my name is Karen and I would like to present to you multidisciplinary teamwork for bariatric retrievals. Sally is a 35-year-old female who lives at home on Norfolk Island, 2 hours flight from Sydney or Brisbane. Norfolk Island has a small multi-purpose hospital catering for residents and tourists. It has 21 beds and complex cases are transported to the mainland. Medicare does not extend to Norfolk Island. Sally is broke and has no way of paying for expensive health care. Sally was found by her neighbour who called the hospital. The St John ambulance volunteers were immediately dispatched with a remote area nurse to assess the patient in the community. On assessment, Sally was found to be drowsy, lethargic, GCS 10, heart rate of 120, blood pressure 90/50, respiratory rate 30, temperature 35 degrees, and SATs 90% on 10 litres via a Hudson mask. She had a very distended, tight abdomen with multiple scars from previous surgery. Sally weighs 200 kilos. Community-based emergency healthcare often requires all agencies' multidisciplinary teamwork. Therefore, all healthcare professionals need to nurture community engagement. All volunteers must be treated with absolute respect and nurturing to ensure you are able to access help in managing patients in the community. You just never know when you are going to be called to a collapsed bariatric patient. The St John volunteers called the Country Fire Service and the local police officer to gain further human resources. A four-wheel drive flat tray ute was used as an ambulance to carry Sally to hospital. On arrival at the hospital, the ACRM doctor assessed the patient and had to make a difficult decision: stay and play, load and go, but where and how. Sally had severe sepsis, circulatory and respiratory failure requiring immediate time-critical early sepsis goal-directed treatment, intubation, ventilation, cardiovascular support and transport to an ICU with bariatric capability. However, Sally is 200 kilos and exceeds conventional aeromedical retrieval stretcher weights. RAAF C-130s may take up to 72 hours to organise due to the process of ADF authorisation, availability, landing site requirements, response time and expense. Due to her bariatric status, she would be at high risk of barotrauma, hypoxia and cardiovascular collapse in flight due to Boyle's, Dalton's, Henry's and Charles' laws. Acceleration, deceleration, dehydration, vibration, motion, increased intra-abdominal compartment syndrome, thermoregulatory dysfunctions and other effects of altitude and transport. The experienced ACRM doctor decided to consult via telemedicine. An intensive care specialist came online in the resuscitation bay via a 50-centimetre television monitor. The intensive care specialist was able to see the patient, doctor and nurse as if he was in the same room. The ACRM doctor collected information for the intensive care consultant. He performed a fast ultrasound, ISTAT blood analysis, collected blood cultures and performed X-rays. The intensive care specialist was able to provide a working diagnosis, direct the team for RSI, bougie intubation, ventilation with a Drager ventilator, order an outline insertion, drainage of the ascites via paracentesis, antibiotic therapy and inotropic therapy. Paracentesis was used to take a sample of the peritoneal fluid to determine the nature of the swelling, example ascites, bacterial, peritonitis or blood. Although this may be difficult in a bariatric patient, it may pay dividends to relieve discomfort, abdominal compartment syndrome and reduce the bacterial load. Up to 11 litres of peritoneal acidic fluid may be drained from the abdomen, releasing compression on vital organs, improving tissue perfusion, blood pressure and respiratory function. Okay, we have got Sally stabilised. Now what? How can we get her to the mainland? She exceeds the maximum stretcher weights on common transport modes. She will need a RAAF C-130 or a cargo boat with a bariatric ambulance costing thousands of dollars. What about risk versus benefit analysis? What can a tertiary centre offer that we cannot offer here? Will this condition respond to our treatment? What complications may occur? Bariatric complications and risks consist of significant respiratory and cardiovascular deficits. The ACRM doctor initiated the bariatric bundle of care to maximise safety and quality of care. Norfolk Island does not have a bariatric ambulance. And it is over 1,000 kilometres over open water by helicopter or plane. Ambulance Service of New South Wales helicopters can undertake bariatric retrievals, however the weather may not permit retrieval. The best option for this patient is to manage her in the community hospital with the assistance and support of telemedicine. And guess what? Most ACRM doctors have extensive training in medicine and surgery. If the patient needs remote surgery for a peritoneal washout, ACRM doctors can do it. Let's just see how she goes, mate. Together we can do this. If not, we can call in the cavalry. Celebrate multidisciplinary teamwork and look after your team members. You will never know when you will need to rely on them for help. Thank you for listening. Over and out.